All right, let's do this. Hi everyone, my name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today's a very much requested episode about how I sleep trained my girls. I do have currently an 8-week-old who's sleep training, and just in general, her sleep hygiene is a little bit more fresh in my mind. So I'm going to discuss mostly what we've done for her and then pull from how we did things differently for my oldest daughter. Again, this is very important for me to say, this is what I did for my girls. This is not what you have to do for your children. In general, you don't even have to go forward with sleep training if you don't want to. I hit on this before in a previous video where I discussed things to consider before you begin sleep training. So this is what I chose to do. This is not what you need to do. First and foremost, if you are considering sleep training, please clear it with your pediatrician. From my daughter's standpoint, I am a pediatrician, whereas I may not be their pediatrician on paper, writing prescriptions, etc. I obviously can clear things like sleep training for my own girls, knowing that their weight is progressing well, that they don't have any medical issues, and of course that I feel they're ready and I feel that I'm ready. Now that that's out of the way, I really want to make sure that we hit on the good stuff. Before I go further, I want to remind you that right now you can buy my book, It's Time to Say Goodnight, a children's bedtime story, in the link below in the show notes. Once you buy it, make sure you DM me a receipt of the purchase and you'll be entered to win a free sleep consultation with me. Now, when it comes to sleep, I was very intrigued by it from the beginning. Before I even became a mother, I was a pediatrician, and I wanted to make sure that the advice I was giving parents was well-founded and evidence-based. So yes, I loved learning about sleep patterns, not just in newborns, but in toddlers and in adolescents as they grow older. I found it very fascinating. When it comes to my own kids, I definitely recognized that both kids were different. Somewhat similar, but definitely had a few differences in what they preferred. With both children, I started off with good sleep habits very early on. So that means trying to regulate circadian rhythms for both the girls, which again can take a couple of weeks. This doesn't happen overnight. It's trying to set routines, and I do discuss the importance of routines in some of my past videos, which I will link right here. And not just setting routines, but also making sure I try to adhere to those routines. So for example, let's say baby has been napping for 1 to 2 hours, and I made sure that they were fed upon waking of the nap. So I wouldn't try to feed maybe at the beginning and then feed in the middle and then feed in the end. I tried to make it a good routine, not just for the baby, but also for my simplicity. I also made sure that I tried to keep an eye on the girls' sleepiness cues. This was a little bit harder for my second child because I was sometimes distracted by my first, but tried to keep a very keen eye for any sleepiness cues. If you have questions about what those cues might be, make sure you leave a comment below and I will do a video on it in the future. And if you don't want to miss any other videos on sleep or other important pediatric topics, make sure you hit the subscribe button as well. Other things that I made sure to keep an eye on was where I was putting baby to sleep. I tried to put my baby down in a consistent place each time. Right now, I am not filming in my home office. I'm actually filming in the baby's nursery. She is still young. She's sleeping in our room right now. So that means that I've shifted myself around to make sure she is still going to sleep in the same place each time. Of course, we are human. We have to run an errand, so she will sometimes take a nap in the car seat. Or sometimes while I'm doing other things, she's in an ergo. Maybe sometimes she's not settling and I'll have to put her in the swing. But I would say for 85 to 95% of naps, she is in her crib with the white noise on and just a fitted sheet. That's really it. A second important thing that I thought was helpful when it came to sleep training my girls was trying not to fuss about the fuss. So babies will cry, babies will whimper, babies will coo, babies will make all types of noises. Their primary mode of communication is crying. But I got to understand my girls pretty well and know what was a cry that was something I needed to respond to, or what was something that she was just kind of light off and on crying and didn't necessarily need me to respond to her. Oftentimes I found that when I rushed in to respond early on, it was actually something that she could have figured out on her own, and maybe I was actually waking her up more. So when I decided to sleep train my girls, I did a bit of a riff on cry it out. That worked for me. I am not saying it works for you. I luckily used all those best sleep practices that I mentioned just earlier. So really the process only took 1 to 2 days because she was already learning how to self-settle. She already had a consistent, familiar environment. She was familiar with her routines. I was familiar with her sleepiness cues. So we were already communicating on a really good wavelength. One thing I do want to clarify is when I say I did a riff on cry it out, that doesn't mean that right now for my 8-week-old, I closed the door and just let her wail. No. I actually sat by her and tried to put her to sleep by herself in her crib while she was placed down, drowsy but awake. So I knew that sleepiness was right around the corner, but she just had to do the last step by herself. Now, I did this with both girls. I thought it was very helpful. Even though they were sleeping in our room, they were still putting themselves to sleep by themselves for the most part and learning how to settle their emotions. So for my oldest daughter, sometimes that meant gently patting her. Oftentimes she really liked when I stroked her glabellar region right here. This girl, my second one, does not really like that too much. Instead, she really likes it more when I gently just kind of, I guess, rock or sway her with my hand over her chest, over her belly. So each baby's a little different, but I let them cry while they knew that a loving caregiver was right there next to them. I don't think at this young of an age I could close the door and just let them cry, but allow them to know that somebody is there. If you choose to do that, that is your own choice. Totally fine. Make sure you clear it again with your pediatrician. Try to be consistent. All tips that I've hit on in past videos. So make sure you rewatch those before you come back and watch this one because it does lay a good foundation. Another clarification I want to give is I let my daughter cry it out because almost 99.9% of methods do involve a little bit of crying. Babies are going to whimper, they're going to cry if they don't, if they're placed into a new setting. But when it came to the crying, to make sure that I remained somewhat objective, I actually set a timer. So 10 minutes of crying really doesn't seem like a big deal. But when you're sitting there and you don't have a clock in front of you and you hear a baby cry for 2 minutes, you feel like it's been at least 10 minutes. So setting a timer in front of me, a stopwatch, whatever, was really helpful because I was able to say, okay, she only cried for 5 minutes. Sometimes when I'm holding her, she's straight crying for 5 minutes. So 5 minutes of crying is not a big deal. Of course, clear this with your pediatrician because if your baby is crying so hard to the point that they are throwing up or having breath holding spells, that's completely different. But for me, I was keeping an eye on her. She was actually learning to self-soothe, self-settle, and would actually cry less and less with each nap. Which brings me to another point. I actually started doing this routine with nap time rather than nighttime. A lot of sleep books tell you the opposite. This is what worked for me because gradually, as she got really good at doing it during the day, and I had a little bit more patience during the day to sit there with her as she put herself to sleep, then she kind of began doing it herself at nighttime and actually did it very well at nighttime when my patience was actually a little less. But yes, I did try and stay very consistent, and overnight I would also sit there and gently rock her or pat her. But again, good sleep practices, trying to set her circadian rhythms early, did allow me to get that night sleep pretty quickly. Another important point that I think that was really helpful when it came to doing this is my daughter was pretty much falling asleep, both girls, by themselves in their crib in a consistent place in a consistent fashion. So when it came time to move them from our room to their own room, the retraining maybe took 1 to 2 days. They really got the hang of it pretty quickly because, again, consistency was already there. Still in the same crib, still the same bed sheet, still the same white noise machine. Yes, the walls look a little different, but when you think about it, a baby's laying on their back and pretty much just looking at the ceiling anyway. So they were pretty much able to transition very easily with, again, just maybe a 1 to 2 day short retraining period. Now, I want to point out too that I think there were subtle differences between both girls. As my oldest daughter was going through this process, I responded to each cry pretty readily. She was my only child, so if I heard her cry, boom, I would be in there. Now, one thing I've noticed with my second one is I will be preoccupied when I hear her crying. maybe I'm doing something for my daughter, or maybe I am trying to fit in that really quick shower between both kids. And I realized sometimes, for example, if I was preoccupied with my oldest daughter, that by the time I actually put everything down and was on my way to the crib, the crying had stopped. So actually, believe it or not, they can do some of this self-soothing and self-settling by themselves if you give them the chance to. That was one thing that I learned that was kind of nice the second time around. It was, you know what? I don't give my kids as much credit as they deserve. They can actually do this themselves, and it was a very nice treat to know that when I was busy with my oldest, my second one could actually take care of herself and quiet herself down. Now, there are a lot of methods out there. This is what I did for my girls. There are no tears methods, there are gentler methods, there are full cry it out methods, there's modified cry it out methods, so many. I do have a video on this coming up, so make sure you again subscribe so you don't miss it. Tune into other videos for sleep training, sleep advice, and good sleep hygiene tactics for newborns and your children. Bye.